Our next speaker, Dr. Robert Block, is well known to the Academy, having served as our organization's president from 2011 to 2012. Dr. Block is an emeritus professor and former chair of pediatrics at the University of Oklahoma School of Community Medicine in Tulsa, Oklahoma. He serves on the board of the Academy on Violence and Abuse and the advisory boards for the National Center on Shaken Baby Syndrome and the National Children's Traumatic Stress Network. He was the founding chair of the Subboard of Child Abuse for the American Board of Pediatrics. His topic today is Adverse Childhood Experiences, Social Determinants of Health, Guidance and Support for Pediatricians. Please welcome Dr. Block.
Good morning, everyone. I want to begin my presentation this morning first with the required I have no disclosure slide, but then by a very important and personal slide from me to you. One of the proudest moments in my life occurred when Marion Burton, who was president before me, put the presidential pin on my lapel and got me started in my new role. Marion died this year, and I think that he was a person who, through watching him and working with him, solidified my understanding of advocacy and the American Academy of Pediatrics' dedication to the health of all children. Consequently, this talk is dedicated to the memory of Marion Burton. One of my mentors from afar is an economist by the name of James Heckman, who has spoken from this podium in various parts of the American Academy of Pediatrics meetings. And he talked about the return on investment for supplying and providing adequate policies and money for policies and programs for children at the earliest ages as a way of investing in our future. And I want to demonstrate with you how that has worked in my life. One of his discoveries was that intelligence and social skills both are developed at an early age and are very important, both intelligence and social skills. He said that major economic and social problems in our country, things like crime and high school dropout rate and adverse health conditions, can often be traced to low levels of skill and social ability, such as, in his words, attentiveness, persistence, and impulse control. So I'd like to share a story with you that some of you may have heard already this week. As an attending in our pediatric teaching clinic, I greatly enjoyed harassing the residents. Once a resident went into the room to see a little boy who had been referred from his school, and she evaluated him in the short amount of time allotted to that evaluation and came out to report back to the attending. And she told me, "This little boy has some real problems. He has very poor attention. He has absolutely no persistence. He really struggles with impulse control." So the teacher has referred him for ADHD, and I believe she's right, and I'd like to treat him with medication. Instead of saying, "Well, that sounds like a fine idea to me," I said, "Tell me about the ecology of this child." She wasn't quite sure what I was up to, nor are you probably at the moment. So let me provide you with a definition of ecology: dealing with the relationships of organisms to one another and to their physical surroundings. And I'll expand it a little bit. Is influencing the distribution and abundance of organisms, the interactions among organisms, and the interactions between the organisms and their environment. I think that's a very important concept for us to consider, and it's just by coincidence, although perhaps ethereally known, that Dr. McMillan's talk and mine are going to mesh in this area, because ecology to me is one of the ways that we deal with the social determinants of health. It is going to be imperative for our residents who are training now and will be training in the future to not only pay attention to the things that Julia was talking about, but also to these social determinants of health, because they're one and the same. On this slide, you can see that there are, and this is a very simplified slide, that there are determinants of health that begin with policies and interventions, and nowhere is that more apparent than here in Washington, D.C., where the policymakers do not understand the value of our children. Our children need access to quality health care, which is a major social determinant of their health, as is the socioeconomic environment where they find themselves, the physical environment where they find themselves, the biology and the behaviors that make each child an individual and a potentially very important person in our evolving society. My interest in this area began not only with Professor Heckman, but also with Vince Felitti and Rob Anda, who in the 1990s evolved the Adverse Childhood Experiences study, which I'm pleased to say almost everyone in this audience probably now knows something about, as opposed to no hands being raised 3 or 4 years ago if I'd asked the question, do you know about the ACE studies? Very quickly, they looked at adverse experiences recalled by an adult population and then related the score of how many of those adversities were related to increased risk for all sorts of diseases. Not only behavioral health issues like smoking and drinking and drug use, but also physiologic diseases, heart disease and lung disease. And you can see that they looked at recurrent abuse in a child's or an adult's remembrance of their childhood, alcohol and drug abuse, having a household member in jail, having somebody with a significant problem with depression or being institutionalized, domestic violence, interpersonal violence in the home, which was a very strong indicator, and having some difficulty with keeping one or more parents in the home, as well as overwhelmingly emotional or physical neglect, and perhaps emotional neglect is one of the major contributors to what happens later in life. You heard that I have the honor and privilege of dealing with the National Child Traumatic Stress Network. And they've done some research about the ACEs being found in how child traumas and adversities affect so many of our children. And difficult to see on a busy slide, you can see, at least in the percentages. In red are the initial ACE study factors. And then we add community violence and sexual assault and serious injuries or accidents, school violence, and other factors that create traumatic responses in children. So those traumatic responses create stress. Here is one definition of stress: a state of mental tension, a cause of strong feelings of worry or anxiety, a physical, chemical, or emotional factor that causes bodily or mental tension and may be a factor in disease causation. So we're left with this hodgepodge of terms. There's toxic stress. There is post-traumatic stress disorder, child traumatic stress, developmental trauma disorder, and on and on and on, making this all very difficult to define and understand. Let me revisit the stress slide, emphasizing here its mental tension, or mental tension again. And here is where Dr. McMillan's talk and mine are going to diverge just a little bit. Mental tension is the same as saying mental health. This is a great opportunity for me this morning because I would like to encourage you to join me in changing the way we talk about health. I once had a meeting in Tulsa with the director of the health department. followed by a meeting with the director of the Mental Health and Substance Abuse Department. And I asked myself, why 2 agencies? I think the answer is so they can fight about very limited resources. Why 2 commissioners? Isn't this all the same thing? I have known about only one figure in the history of man and womankind whose brain was not connected to the rest of the body. Here's a clue. For the rest of us, the brain is an important organ, no less important than the heart or the lungs or the liver or whatever you care to mention. And yet, we have used the term mental health inappropriately, or at least it is used against us inappropriately, because how many of you have seen a child for whatever you want to call it, a social problem, a behavioral problem, a school problem, whatever it might be, and you've coded the visit and you've sent it in for payment, and the letter comes back and says, we're very sorry that we're not going to pay you for this visit because it's a mental health disorder and the coverage on our insurance does not provide payment for mental health disorders. So, I want you to start using the term brain health. You'll understand, and others will understand too, that it is a replacement for the term mental health. But what it does is it allows us to realize that the brain not only is responsive to the rest of the body, but the body is responsive to the brain. Separating them makes absolutely no sense. And as you heard from Dr. McMillan, we need to train our new young pediatricians to understand the brain's connection with the rest of the body in which it resides. Now, I found a place that actually understands this. I went into a local bookstore in Tulsa, searching for a couple of appropriate books for my grandchildren, and I sort of browsed around a little bit, and look what I found. This is a whole section in the bookstore, and after living your best life, it says brain health. I found the manager, congratulated him, hoping maybe he'd give me a free book for my grandchildren, but that didn't happen. So, the American Academy of Pediatrics, in helping to provide guidance for the pediatrician, is in the process of developing our Center on Healthy, Resilient Children. The goal is to build stronger families and eventually, if not end, at least put a big dent in toxic stress in the environment, the ecology that so many of our children are living with. So what are we going to do? Well, the vision is to create a world where our children have an optimal opportunity for brain development, and to see brain development as a foundation for later health. Our mission will be to use evidence-informed strategies to prevent and reduce the effects of toxic stress, which again is a real threat to optimal development. And not only in the United States of America, but throughout the world. And to all of you who are here as international guests, let me invite you to participate with us in looking at these issues and working together to make life better for children around the world. Our priority areas are going to look like this. We want to establish practice-based policies, measures, and interventions. We want to support community-based research. We want to unite major stakeholders, including payers, to jointly address the effects of toxic stress. And we want to have good partnerships between healthcare and other systems. The first question I'm always asked by someone when I'm talking about this on an individual patient level is, well, what am I going to do if I look for social determinants of health, or I look for toxic stressors, or I look for childhood adversities, and if I find them, what do I do? I can't manage those within the practice, which is true. But there are community resources to help us. There are early educational programs that we can interact with, and the American Academy of Pediatrics is very, very pleased to be working hand in hand with Head Start programs. So I think that there are ways that if we can include looking at ecology in our evaluations of children and their families, we will be able to help the children as they move on. 3 years ago, I had the opportunity to speak from this podium as president of your American Academy of Pediatrics. And I showed this slide, and I want to show it again. It's a quote from our President Kennedy in 1963. He said, "The needs of children should not be made to wait. We can say," he said, "with some assurance, that although children may be the victims of fate, they will not be the victims of our neglect." He was wrong. He was wrong. Some 50 years later, a great many of our children in this country, and a greater number of children throughout the world, are indeed victims of our neglect. Not yours, or yours, or yours, or mine, but collectively, the people who make the rules and regulations, the people that distribute the investments, are the people who have let our children down. And the needs of children cannot be made to wait. Why is that? Well, simply stated, I think this is what I'm going to put on my tombstone. All adults once were children. Is there anyone in this room who was not a child? Is there anybody in this room whose childhood did not in some way influence who you are today? As we are dedicated to the health of all children, we need to be dedicated to their overall well-being, to paying attention to their ecology, because what happens here, and I think you can see the silhouettes of the young children, what happens here influences what happens here. That in turn influences what happens here, and ultimately influences what happens here. So let me recap briefly. A few key points that I'd like you to take home with you. First of all, ecology is important. Pay some attention to what's going on in the households of the next patient you see. What does their family look like? Where do they live? Who lives around them? What's the neighborhood like? Look at their social determinants of health. In Tulsa and in Oklahoma, we have this horrific reading test at the end of 3rd grade to try and get some idea of where a child is. It's pretty silly to think that you can, in 2 hours, tell where a 9 or 10-year-old child is in their total life. But a very interesting thing happened when we looked at the results of the tests. In children who were in schools in impoverished neighborhoods in our community, only about 33% passed the reading test. For children in schools in my neighborhood and neighborhoods like mine, the pass rate was about 98.5%. For those children where only 33% passed, why is that? Nobody bothered to ask them if they were hungry before they took the test. Nobody bothered to ask them if their father beat up their mother on the night before they took the test. Nobody bothered to ask them if they had some chronic diseases like asthma, which are heavily influenced by social determinants. So we have a job to do. Remember the ACE studies. Remember the association of stress to health. Remember, please, it's brain health. And remember, please, all adults once were children. Thank you all for this opportunity. Bye-bye.